Does your purse look like this? If so, stay tuned because we need to talk. Sheryl Wilson, registered nurse here for S. Wilson Educators, and today I'm going to be talking to you about lymphedema. A lot of people don't even know what that word means, so let's break it down. Lymph means fluid, edema means swelling. Swelling caused from a compromised lymph system. What is the lymph system? It's called the lymphatic system. It's a network of tissues that helps to rid the body of toxins and infections. And amongst this lymph system is lymph nodes. Lymph nodes act as a strainer to catch any kind of infections. Have you ever been to the doctor and they check you here or wherever? They're feeling your lymph nodes that run here. They're trying to feel if they're enlarged. If they're enlarged, they know that strainer has been catching some kind of infection. That's what it's all about. But in the case of what I'm going to talk to you today, I'm talking to especially my pink sisters. Those of you who have had breast surgery or breast cancer like myself, they usually will remove some lymph nodes, and so your lymph system becomes compromised. The more lymph nodes they remove, the more compromised you are, and the more they remove, the more you have to listen to what I'm going to say today, because you want to decrease the odds of ever getting lymphedema. Lymphedema is never pretty. If you get it, it is never curable. It is only treatable. I have seen as a nurse some people's hands get double, triple the size, and their arms get double, triple the size. And if it gets like that, it's a little late. Now they can treat it, and you might have to be wearing something called a pneumatic compression machine that you have to sit there and it does its work to get that fluid back out. Because if the fluid doesn't come out, it stays in here. We've got some more medical issues to deal with. So what we're trying to do today is to educate you on what you need to do to decrease the odds of getting it. Now, when you got discharged from the hospital, I'm sure they told you, don't let anybody take any blood pressure on that arm, and don't get any needle sticks on that arm. You shook your head yes, but you don't have any clue why. These are some of the things that you can do, but I'm going to tell you about some more. But first, let me explain a little bit what happens. The lymph fluid goes all over your body. It goes in, it collects any kind of infection or inflammation, and it comes back out. If it's compromised and you've taken these lymph nodes out, when it tries to come back out, it runs into a dead end where those lymph nodes used to be and they're no longer there. So it has to find an alternate route. Thus, you're in a compromised state. So what we have to do now is minimize anything that will cause any more reason for this to be compromised. What can we do then? You don't want to be having anybody pumping on there, because you already have a compromised system. So just don't let them do that. When they do needle sticks, there's a possibility of introducing infection. We don't want to introduce any kind of infection. So don't let them do that. What do you do in your everyday life now? First of all, let me tell you that infection things. If you are someone who likes to bake, you can still bake. Just be very careful about maybe not putting your hand in the oven at all. And if you do have to put it in the oven, protecting it with the mitt. You don't want to get a burn. If you like to do gardening work or anything like that, you don't want to get any kind of stickers in your hands or injuries, because that could be a reason that lymphedema could come on. So you need to wear your gloves. If you would get cut or anything like that, just know that the only thing you have to do differently now is you need to treat it right away. You don't wait for 2 or 3 hours when you come in the house and take a bath after you've worked in the garden. You need to leave the job that you're doing right now, come in, wash your hands with at least soap. Antibacterial soap is even better, and if you can, put any kind of antibacterial ointment on it as well, if you can do that. That's the main thing that you have to do if you get any kind of injury to that arm. Now also, I don't want you to wear anything constricting on that arm. No tight bracelets, no tight watches. If you have any clothes that have elastic here, or any jackets or anything like that, give them away, get rid of them. You don't want them even in your closet. You do not want any kind of thing constricting on you, because again, just what I just now told you, the fluid has to come out. You don't want it to run into that dead end and have to be diverted. You don't want it to get caught up in that elastic and it can't get out either. then you're going to have a big swollen arm as a result of that. So we don't want to do that. What other kind of things that they didn't tell you in the hospital? Number one, that 10-pound weight limit, ladies. I know it's going to be hard for you not to lift things with that arm 10 pounds or more, but you have to try not to do it on a regular basis. You have to learn how to do things a little bit differently. I can tell you, I load my ice chest for my camp. I used to pick up the ice chest. Now I put the ice chest in the truck, put a little ice in it, bring my food in a bag to it, and maybe several different bags to the ice chest. When I get to my camp, I unload it in reverse. I never pick the ice chest up. That's something I needed to learn how to do because I do this on a regular basis. Is it going to hurt you to pick up something over 10 pounds once? No. And I will tell you, I have a little dog that weighs 35 pounds. If the house was on fire, I'm going to pick him up and bring him to safety. But it's not something you want to do on a regular basis. So if you have a job that requires you to pick up things all day long that are over 10 pounds, you may consider getting another job. If you are a lady who likes to work out with weights, I'm not real worried about the little 2 or 3 pound weights for conditioning reasons, but if you're that weightlifter lady, you may consider not doing that anymore. You are going to put yourself in a compromised state by picking up all of these weights. Something I never told you about was sunburn. That's a big one. People forget about sunburn. If your arm gets really sunburned, it's going to be very inflamed. The inflammatory process is there. You're really going to have a problem with these lymph nodes trying to get this lymph out of your body. So slather on that heavyweight sunscreen, wear protective clothing over the top of it if all possible. Just try to avoid the sunburn. Also, purses. I tell you in the beginning of the video, we have to talk if you're using that big old giant purse. People don't think about this. I've seen ladies already in some of my meetings that I've gone to with breast cancer survivors, and I'll see them throw all that stuff you just saw in that purse, those water bottles and things, and I cringe, and I have to go talk to them and tell them why they shouldn't be doing that. So what I want you to do, you got those big old giant purses, give them away, get rid of them. Switch to either a smaller purse, switch the other side if you can put it on the unaffected side. My favorite thing to do is have the unaffected side strap here and have those crossbody purses. I have those in a lot of different styles and colors. That seems to work out very nicely for me, so you can do that. But the main thing is you have got to protect yourself. Once you get to the point in your surgery where you are mostly healed, I would like you to ask your doctor for a prescription for a lymphatic sleeve. Now, if you get lymphedema, they're going to order you one of these because you're probably going to have to wear it for the rest of your life. But in the prevention part of it, like I'm talking to you today, if you're someone who will have to get on an airplane at any time in your life, you should have one of these. So get it and keep it. It is something that you get a prescription for. You go to a certain place, they measure your arm, so it is a custom sleeve for you. It's going to take a while to get it, so don't wait for 2 or 3 days before you leave on a trip to get it, because it's not going to happen. And here's what the sleeve looks like. It's called a compression sleeve or a lymphatic sleeve. It does look like this. And it goes from the top part of your arm here to all the way down to your wrist. It's made out of a stretchy material, and it provides some compression, not constriction like that blood pressure cuff, but some slight compression on your arm. It takes a little bit to get it on. You might need even some help to get it on. But once you do, and it's kind of firm on your arm, you put it on before you get on the airplane, and you don't take it off until at least an hour after the flight is over. And what this does, have you ever heard of anybody getting on a plane, take their shoes off, and then when they land, they can't get their shoes back on because their feet are all swollen? Well, that's the reason why you're wearing this sleeve. You're trying to keep a lot of that fluid from going in your arm because there's pressure changes that happen on the plane that causes the swelling in the feet, and it is the same thing. So by having this compression sleeve on, it limits the amount of lymph that can get in your arm, thereby limiting the amount of lymph that has to try to come back out under those pressure changes. This is well worth it to have this, ladies. I put it right by my luggage. It stays there so that I don't forget it when I am packing, and it is a very, very important thing, especially for someone who flies often. So don't forget that. I hope I've helped you all to understand the lymph system and try to decrease the chances of getting lymphedema, because lymphedema is a lifelong thing if you get it. It's never curable, it's only treatable, and we need to prevent getting it if at all possible. And it can get very devastating if you get it, and you may have to use a pneumatic compression device in your home, hour, 2 hours a day, whatever's prescribed to you. So it gets to be a lifelong medical condition if you get it. So we don't want to get it, and if you do start noticing any tightness in your arm, any pain in your arm, any change in the size of the measurement of your arm, please, please, please go see your doctor and get him to refer you to a lymphatic specialist so that they can get that lymph fluid out of your arm. I hope you've enjoyed this video. It takes a lot to produce a video of this nature. So to motivate me and to keep me going to produce more of these, please press that subscribe button down in the bottom, press that like button, and definitely share it, especially on these sites where you talk to other breast cancer survivors. We all need to know this information. I thank you for listening. Sheryl Wilson, registered nurse. We out. Bye.